It's Wendy Bowen with Know Your Body Better. So as a physiotherapist, I see a lot of people with back pain. And sometimes the pain goes down the leg, which remember we call sciatica. But a lot of the back pain is we have degeneration as we age. It's just one of the normal processes as we age. Sometimes people age faster. You have your vertebral spine here. The discs sit between the bones. And these holes, the foramen, are where the nerves come out. Now when that disc, with normal aging actually, the disc may thin and go up into the bone a bit, so you get narrowing. With abnormal aging or disc degeneration, that disc thins and the holes get smaller because the vertebrae come closer together. Now if the back muscles are tight, the muscles that run up and down the spine are tight, they're going to compress us even more. Remember I talked about loosening off the muscles to take some of the stress off the joints. The other thing that you'll often hear is decompression therapy, traction. So there are some ways, there are some machines we can hook you up that will traction you and kind of pull things apart a little bit, separating the joints a little bit, taking the pressure off or the compression off the joints. But how do you self-traction? Well, there's a couple ways. We can traction in flexion, which is the forward bending, or traction in extension, backwards bending. So I'm going to show you a couple ways to self-traction. So one of the ways, have a therapy ball. You just lie down on the bed, put your feet up on the ball like this, and what I like to do is actually, when I'm lying in this position, put my hands underneath my butt to take my back into more flexion. And that's going to open up those joints and give you a bit of traction. And you can just lie like this for 5-10 minutes, whatever feels good. There are some people that really like to traction just by going over top of a ball and just hanging like this a little bit. Now you have to be good at hanging on the ball or over top of the ball, and usually you would do this on the floor and they just traction down this way. If that's too much, get rid of the ball, you just get a pillow. And remember, when you do anything like this, the pain, if you have pain in your leg, should be coming out of the leg, going into the back. So you want to centralize that pain. So you just lie like this over top of the pillow and see if that relieves some of your back pain. Now another one you can do for sciatic pain is you can actually do this cobra position. So you're lying on your tummy. If that's getting rid of it, you can come up into this cobra position, not a full cobra, but you're taking your back into extension. Now this is compressing the back a little bit, but if you have disc pain that's disc problems creating sciatic pain down the leg, this may bring the pain up out of your leg into your back. If it doesn't, it goes the other way. You don't want to do this one. The last traction I like, this is my extension traction, this is the one that gives me the most relief, is I just lie down with my feet and legs from the knees down, hanging off the bed. It arches my back a little bit, which would be more compression, but I get some traction with this. And I just can lie like this for 5 minutes and this will ease my back pain. It doesn't necessarily bring pain out of my leg into my back. That's the lying on the tummy one for me. But this is a nice easy way to traction if you're getting some joint compression. So back pain can be caused by a number of things. Joint compression, it can be a disc problem, it can be just tight muscles. So we have to look at a number of different things that will give you relief. But those are some ways you can try to get relief with back pain and even some leg pain. So it's Wendy Bowen, physiotherapist, signing off with Know Your Body Better.